I test all of my patients with adenocarcinoma who have advanced disease. I think that that is a very clear indication for testing for molecular markers. Regardless of smoking status, age, gender, I test all patients with adenocarcinoma. Beyond that, particularly for the patients with squamous cell carcinoma, they have a less clear indication in my mind for testing for markers, and that's because we know that they don't have very commonly mutations that are targetable, including EGFR and ALK. However, the concern with biopsies in many patients is that we often will get very small samples from an FNA or small pieces of tissue, and there could be a sampling error in terms of histologic characterization. So we may consider someone having a squamous cell carcinoma, but they actually may have an adenosquamous cancer. And those patients may actually have targetable mutations, and it's really important to know what they may be. So in patients that I have a concern that there may be a sampling error, if there's a small amount of tissue or they had an FNA, even if they have squamous cell carcinoma, I will still send that tissue for molecular testing. And I will include in my thoughts about who to test, I will think about smoking status, in that if a patient who is a never smoker or a light smoker, if they have squamous cell carcinoma, I will test them as well.